Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Joint pain is something a lot of people have at some point, especially in the knees, the shoulders, or the hips. But what if that pain is more than just wear and tear? What if it's something called bursitis? Today, we're uncovering what bursitis is, why it happens, and the exciting new treatments that are giving patients real relief. Joining me today is the brilliant and compassionate Dr. Bryn Henderson, a regenerative medicine expert who's helped countless patients regain the quality of life without surgery. Dr. Henderson is a board-certified physician specializing in regenerative and preventive medicine. He brings years of experience in treating chronic joint pain using innovative therapies like platelet-rich plasma, peptides, hormone optimization. He's not just changing lives, he's redefining recovery of pain. Dr. Henderson, welcome to Doctor.
Thank you.
What exactly is bursitis?
Great question. Bursitis is the inflammation of swelling of a small fluid-filled sac in your body called a bursa. These sacs act like cushions between your bones, tendons, and muscles, helping everything glide smoothly. But when a bursa gets irritated, it can swell up and cause pain, stiffness, and even limit your movement. It's common in areas like knees, backs, shoulders, hips.
So you mentioned that the bursa is little sacs. How many sacs of bursas do we have in our own body?
The number of bursa in the human body is probably a very good question. I think that if I had to guess, there's 160 bursa in the whole body. These fluid-filled sacs, the cushions, they're like lubricants. They're like washers in your plumbing.
So you could have bursitis in 160 different places in your body?
Yes, ma'am.
Does bursitis come from injury?
Not always. While injury or overuse, like kneeling too much or lifting heavy things repeatedly, are common triggers, bursitis can also be caused by infections or medical conditions like arthritis, gout, diabetes. Sometimes it happens without a clear reason. We call that idiopathic.
Well, who's most likely to get it?
People who do repetitive motions, athletes, laborers, even folks who garden a lot are at risk. Older patients, people with diabetes, or those who are overweight also have a higher chance. Women tend to get hip bursitis more often than men, and men develop in the knees and elbows more often than women.
So how would someone know that they have bursitis? What's the first symptom?
Most people feel pain right over the joint, and it might be swollen and worn, like a cellulitis. Sometimes it's painful to move, or you notice stiffness first, especially in the morning. Infected bursitis can even cause fever. If it's chronic, the swelling might remain, but be less painful, just uncomfortable.
So how do you diagnose bursitis?
Well, we start with a physical exam. After the history, we listen to the patient's symptoms first. If needed, we start with imaging, something simple like ultrasound, or rarely MRIs, to see the swelling or rule out other issues. If we suspect an infection or a gout, we draw blood so that we determine the type of infection or inflammation.
All right, then let's talk about treatment. How in the world do you treat 160 different places of bursitis? It couldn't possibly one size fits all of the bursas. No. 160 in one human body.
You're absolutely right. You begin with basics. You start with rest, ice, and anti-inflammatories. And we suggest avoiding whatever the trigger, repetitive movements usually. In tougher cases, we may use a steroid injection. That's rare today because of the peptides. You can remove fluid from the bursa, but you have excellent results with new therapies like platelet-rich plasma. PRP and peptides have given us far better results than steroids.
All right. So share with us a case that you recently treated.
Absolutely. We had a 61-year-old man come in with severe pain in both knees. He had tried braces and conservative therapy with no luck. We treated him with PRP and peptides like BPC 157 and thymosin beta 4 over several visits, and his pain went from 7 to 0. By the final visit, he had full range of motion, no swelling, and was back on his feet.
That's a powerful recovery. How exactly did the PRP help her?
Oh, PRP has 4 major facets to it. It is growth factors, healing factors, and it makes new blood vessels, which is key to healing, and it reduces pain. So it's from your own blood, and we concentrate the platelets because we do a double spin. It stimulates the tissue repair, reduces the inflammation, and promotes natural healing.
Okay, you mentioned BPC 157. It sounds like something from a futuristic movie, like RDD2 or something.
Right. Oh, yeah, I remember that.
Yeah.
Okay, now this is BPC is body protection compound 157. Nearly all peptides have letters and then numbers.
Okay.
And so this one is probably the most common for musculoskeletal, and it helps GI. So it treats things like Crohn's, but this speeds up tissue repair.
How often can a person get it?
Oh, they can get it daily if they have to, but we rarely have to give it every week.
Could someone give that to themselves?
No, because they don't have a license. This is prescription.
This is not over the counter, folks.
No,
Sorry if we.
And in different states, it's against the law to practice medicine without a license.
In all states.
And they have defined practicing medicine as giving an injection in muscle.
Oh.
If it's sub-Q in your tummy and you're diabetic, that's not against the law. But if you try to do muscle injections, nearly all states have that as a practicing medicine without a license. So the answer to the question is no, but it's particularly helpful in stubborn cases and when you want to avoid steroids, which we do, because they thin the ligaments, the tendons, and cause muscles to get weak. So we avoid those today and use PRP for better results.
Okay, so are there any other natural options like supplements or alternative therapies that a person can choose?
Yes, absolutely. Vitamin C is very helpful. It reduces inflammation. It helps your body rebuild the collagen. Acupuncture and prolotherapy are also gaining ground and being used commonly. We use prolotherapy most of the time with the BPC 157, and it helps heal torn ligaments, or mostly tendons and muscles.
Let's tell our audience what prolotherapy is. It actually has quite an interesting history.
Now, prolotherapy itself is a heavy sugar, and it helps the nutrients around the damaged tissues. That's why it's used so often and with such good results.
All right. So now we have 160 bursts all over the body, and you're treating the knees, and then somebody comes in and go, "Oh, my elbow, doc. Oh, my ankle, doc." Can it be prevented so it doesn't come back? Or does it slip around the body because someone is susceptible to these bursts getting inflamed?
It can come back, but if you take the time to determine the trigger and then prevent the trigger, it doesn't. You mentioned the elbow, and the olecranon bursitis is very common for people who drive trucks or something and constantly put their elbows on that side of the car. And so you find that we had one of those yesterday, and they fill up with this little fluid, and what you have to do is calm it down. And we often give them ways to cheat. We give them the pads that basketball players use on their elbows so that then they don't aggravate the burst of the joint. And that's a good idea for all of them. Maintain a healthy weight, of course. Use joint protection. That's what I'm telling. The padding and proper warm-up stretching. You got to avoid the repetitive stress, though, if that's the trigger. For some patients, we schedule the maintenance treatments every 6 months just to stay ahead of it.
All right. So what is your message that you want our listeners to take home?
Well, Bursa Relief, the message we give, Bursa Relief is a simple mnemonic that gives the practical roadmap to reduce the pain and protect the joint.
All right. B stands for what?
Balance rest and movement. Rest during the flares, but avoid total inactivity.
U.
U stands for the use of ice for swelling. Applied every 15 to 20 minutes, a few times a day.
R.
R is reducing the pressure. Avoid the kneeling, the leaning, the repetitive motion.
S.
Stretch gently to prevent stiffness.
A.
Is anti-inflammatory medications.
R.
Rehabilitate with therapy. The therapy can be physical therapy, kinesiology therapy. It builds strength and stability.
E.
Elevate when possible, especially useful for knees and elbows.
L.
Listen to your body. Don't push it. Don't hurt. If it hurts, please don't do it.
I.
Inject if needed. The PRP and the peptides are very helpful in persistent cases.
E.
Examine posture and technique. Adjust how you move, sit, or exercise.
F.
Follow up with your provider for imaging or further interventions if the pain continues. It's all about consistency.
So I guess if you choose to follow this Bursa Relief mnemonic, you can get close to staying pain-free. And I want to thank you, Dr. Henderson, for the incredible insight about bursitis and that it doesn't have to control one's life. From these advanced injections to the peptides, to the prolotherapy, to the PRP. Thank you so much, because medicine is changing. We're about to move into another world. So if you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.